Hello, everyone, and welcome to my podcast, Don't Get a Therapist Yet. Today, I am very honoured and privileged to have a guest. Her name is Michelle Rowlinson, and she is a senior physiotherapist, menopause wellbeing practitioner. So, a warm welcome to you, Michelle. I'm very pleased to have you on the podcast today.
Well, thank you for having me.
So, Michelle, if we could just start by telling the audience a little bit more about yourself. I know about you, but I really would love the audience to hear more about you.
Yeah, so as you said, I'm a senior physiotherapist. And a couple of years ago, I became a menopause wellbeing practitioner through basically my own journey and realizing that I wasn't alone with it, which led to me writing a book, which I didn't really think would go anywhere. That was ways to actually help yourself through diet. And it went bestseller rather quickly, and women started asking me for advice. And I thought, oh, I better get qualified in this. And it just spiraled into me realizing just how failed women are in work, at home, with health professionals. So yeah, it's been definitely a journey.
It sounds an amazing journey, and thank you so much for sharing all your information and helping so many women. And that's great. You've actually got a best-selling book all about menopause. Is that correct?
Yeah, so it's on anti-inflammatory diets. So it's got recipes in it as well, because one thing I found once already knew the power of anti-inflammatory diets, but I didn't realize that they could significantly reduce menopause, other conditions, but menopause symptoms as well. But when I was Googling, often the ingredients were sort of American ingredients or expensive Amazon ingredients or ingredients with names that were so long that it put me off, and I love to cook. So I made sure that these recipes, all the ingredients you can actually get in our normal supermarkets, and they're easy to follow as well.
Wow, that sounds amazing, and I'm very interested, obviously, in health and well-being because the impact um, it affects both, doesn't it? I think if you get your health better, your mental health is better, and so there's a sort of direct correlation, I think, and that's why I'm so glad you agreed to come on my podcast, and it's going to be such an empowering conversation. I know that, but so you got best-selling book. What else are you up to at the moment, Michelle?
I have my own podcast, Menopause, the Real Deal, where we get guests, all sorts of different guests, from health professionals to business owners to women's real stories, lots of holistic approaches, because no one fits all. We can't sit there and say, right, you must do X, Y, and Z, because what works for one woman doesn't necessarily work for another, because we're all individual, whether that's HRT or diet and lifestyle.
You're so right, Michelle. I couldn't agree more. As a psychotherapist myself, one of the main principles is to actually see the person as an individual, and it's taking all that sort of information range to actually help people to sort of steer their journey through a lot of confusion, I think, that happens regarding menopausal issues as well. So you've got a podcast, but I understand you do a lot of workshops as well. Tell me more about your workshops.
Yes. So one of the things that I realized when I sort of went down this rabbit hole was that 1 in 4 women actually lose or leave their job. And I was one of them. As a senior physio who actually had people requesting me personally, in fact, one person actually hunted me down after I left, but I just didn't feel good enough. And this is quite a common thing, that women are either leaving or stepping down in a role or getting a easier job because they're just not coping with how they're feeling. They might not even know it's menopause related. And it's quite a scary time for some. I mean, I thought I had onset dementia, and I was suddenly getting crippling anxiety attacks, and I'd ballooned 20 kilos in weight. My hair was falling out. I had acne. It was just so many different types of symptoms. And all I was being told by my doctor was I was stressed, I was depressed. And I was like, well, yes, I've got quite a stressful life, but there's more to this. There's more to this. And it's quite shocking that actually a third of women haven't heard of the word perimenopause until they start having symptoms. And that was me as well. So this is why I now do workshops for businesses. I have I can also now do menopause champion courses so they can have an appointee as well, sort out their policy so they can advertise as being a menopause inclusive environment because actually it costs businesses thousands in absenteeism, re-recruitment, even presenteeism when they're just not being as productive because of symptoms that actually with the right education um, can actually help the whole, even the dynamics where women might be falling out with people or so yeah, so that's one of the things I do is for businesses. And then the other side is I train health professionals. So I've 2 years in a row trained trainee GPs at the Norfolk and Norwich Hospital and been asked to come back next year. And I have a CPD course as well for health professionals. So they can actually get that knowledge because even as a physio, I we were trained that women 40 plus are more predisposed to frozen shoulder, tendinopathies, joint pain, but I didn't know why.
Mm.
And even along my journey, my dentist didn't mention hormones when I was spending a lot of money to stop my teeth falling out. My cardiologist tried to give me beta blockers for my heart palpitations, no mention of hormones. And as I said with the GP, but it's also opticians should be trained because we get dry, gritty eyes and eyesight problems sometimes. Um, Lots, even psychotherapists or even beauticians because our skin changes.
Mm.
So there's lots of different professions that actually, by having this knowledge, you can save misdiagnosis or unnecessary treatments. So yeah, so it's really important that everybody gets educated so we can sort of join those gaps.
You're so right, Michelle. And I think, I often see women who are sort of, could be perimenopause or what, but they go for help. And they're often given depression medication, which doesn't work, does it? And then they have the confusion, and then what's wrong with me? And then, like you say, that then leads into sort of uh, losing their confidence as well, and not feeling control of your emotions and your mind. I think is a really underestimated issue. It's just so anxiety provoking and so distressing if you think I can't, it's bad enough, being a woman and having hormonal sort of periods and everything like that. But when you think, well, what is wrong with me? Why can I not control? And why can't anybody help me? The amount of suffering that women go through with this issue, and you've come up with such a brilliant way of helping women. I think you're on a mission, aren't you, to help as many people to educate health professionals to really understand what the symptoms are and what's wrong with them. And the more you understand, then the more you can actually deal with them.
Mm. And this is what in my workshops, they're more than just about menopause. I go into diet, lifestyle,
Mm.
mindset, de-stress techniques. So it's very relevant for men as well. Get a lot out of my workshops because they not only learn how to be healthier themselves and de-stress techniques and things like that. But at the amount of light bulb moments we've had where they've been like, oh, that explains a lot with my wife. Or when I go into misdiagnosis, and I had one guy that was like, oh, my wife has literally just been diagnosed with ME. And obviously, I always say, well, obviously, I don't know your wife. It may be ME, but it's a conversation that you can now have. Is it because I think she was early 40s. Is it because the doctor thinks she's too young, which is often quite a common one? And so they've given her that diagnosis, or is it a true diagnosis? But because, as you said, your mind has a big impact on your body. I I teach also about sort of the biology side of it because if you know why it's happening,
Mm.
you then understand why certain treatments will work. So as progesterone is declining, it's a
Mhm.
forgotten hormone, which annoys me that if you have a hysterectomy, you're not offered as standard progesterone
Mhm.
because it has a calming effect on the central nervous system and it's not just about your womb. So this is why when it starts to decline, even if you're not in perimenopause around sort of 35, then women are starting to have sleep issues, anxiety issues, because it's linked to progesterone. Equally, estrogen has a big part to do with your dopamine and serotonin, your neurotransmitters, and it also plays a big part in blood flow health to your brain. So this is why we end up having sort of lots of low moods or erratic moods because declining hormones as well as testosterone, which is another forgotten one,
Mm.
because we have testosterone receptors in virtually everything, just like estrogen receptors. And again, it's not just libido, it affects energy, it affects muscle, bone, which is why men, when there's decline, they go through sort of the midlife crisis, which is basically their version of kind of menopause. But this is why their energy levels and personality can change because it's not just libido. So again, it's something else that's a bugbearer that it's where testosterone isn't licensed for us yet. So
It's so important. I'm so glad you've included men in this as well, so that they can understand it from their own perspective, but
mm,
also from the females in their life as well, and what they're going through. I think that's a really, really good point you made as well. And I think also when when you get a little bit older, people often think, oh, you're stressed or you're working too hard or you've got a young family or it's just because you're older, that's why you're getting more tired. But I think you're giving a really good message there because what you're saying actually, no, we don't have to be tired just because we're getting a bit older. We need to look at the way our body, is working and understand it so much better and what to do about that. So it's a very different, very, and like you say, a lot of people that I see don't sleep, can't sleep, terrible, terrible sleepers, and then you're exhausted. So you blame it, you can't sleep, but you're looking at the underlying problem of hormone imbalance as to the cause of all these symptoms.
definitely. And another reason for sleep could be high cortisol due
Mm.
to stress or other factors can be caffeine. Many people don't realize that it stays in the system for up to 8 hours. So actually trying to avoid um, caffeine after 2 o'clock in the afternoon can help. If you are getting that 2, 3 a.m., try doing de-stress techniques, breath work before you go to bed. That can really help, or being hydrated. So there is lots of things that we can be doing, and it annoys me when even a lot of health professionals say, oh, incontinence is just a sign of aging, or such and such is just one of those things. Well, actually, unless you've got a, a surgical medical reason for incontinence, it's never too late to strengthen your pelvic floor. Or frequent UTIs actually can be a sign that you're in perimenopause or menopause. So local HRT can actually help towards frequent UTIs or incontinence. So there's lots of different, even when you're on HRT, the majority can have local HRT as well because it's not systemic, as well as women that can't or choose not to have HRT. There's only a small minority that still can't have local.
Mm.
So it's just having that education of you don't have to be suffering. Um, Particularly older women that are told that they're too old for HRT. Again, the majority, that's rubbish because we've got the transdermal HRT through the skin. So there is no kind of timescale on that. It's all individual to every woman. Equally, you're not too old to start HRT, transdermal body identical HRT. You won't get the same long-term benefits as taking it younger. But if you're struggling with symptoms, then that's something to be aware of. Particularly, I've seen a lot of care homes, elderly women with frequent UTIs. And this is why, again, I'm trying to get into training staff at care homes because these women, and it's one of the one things that actually can be fatal because you can end up um, with, and I'm having my own menopause moment now. Can't think of the word now.
Memory loss?
That one, no. blood poisoning when
Yeah.
it's
Oh yeah.
yeah.
Yeah,
So
blood poisoning's fine. I get that.
but but yes, so I'll think of the word later. But yeah, so UTIs can actually be fatal for women as well. So it's really important that to be aware that actually local HRT could be helping with some of these symptoms.
You know,
Sepsis, that's the word, sepsis.
sepsis. Yeah, yeah, yeah. That's great. Sepsis, yes. I mean, that's really amazing, Michelle. I mean, I would never have thought that as well because I think the message is getting through that it's okay to have HRT now, whereas most people were discouraged from having most people, most women were discouraged from having it before as well. So that's really coming through. But to actually say, you can have it as a more mature woman and it can really help with urine infections. I mean, that's brilliant because I think urine infections also, I understand it makes your m- brain more confused, doesn't it? And then that can be misinterpreted as more dementia or dementia sort of symptom, whereas it's actually it could be a UTI. So that's really good. Can I just go back and just in case the audience hasn't heard about these transdermal patches, Michelle, can you just explain a little bit more about what that is? Because some people might be quite interested in that.
Yeah, so you can get them as a patch, gel, or spray. Um, and again, with the patches, you can either have them combined with progesterone, so it's a progestin, a synthetic one, or you can take your progesterone separately as eutrogestin, so it's body identical, made from sort of yam plant, and literally it is what it says. The body treats it as its own hormone. So it's a lot of women who find that they couldn't take contraceptive um, pill is because they were sensitive to the progestin
Hmm.
patch and they think, oh, I can't have HRT because I reacted badly to contraception, when actually they may well be able to have body identical. Equally, some women are sensitive to the body identical progesterone for some reason, and they get on better with the synthetic. So again, we're all different, but it's just being aware. HRT is very trial and error. It's one of the most hardest things to get right. So it is important that just because one hasn't worked, equally with the patches, they actually have different brands. So different brands have different ingredients in the glue. So you might find that your skin is sensitive to one or it doesn't stick, but you might be okay with another one. Our skin absorbs differently, so that's why some women need a higher dose. There was a panorama that I think was more like a witch hunt for Dr. Louise Newson on her high doses. Yes, maybe some women didn't need them quite as high, but she has a valid point that because our skin is different, some women just don't absorb as well. So they're not getting the same dose as someone else having 3 pumps or something. So yeah, and I think it's also important just to be aware that even if you're on HRT, you still need to be looking at your diet and lifestyle
Yeah.
to get that rounded thing. But yeah, and the spray, that's the one that's put a lot of doctors actually don't even realize the Linzetto spray, and you just do 1, 2, or 3 pumps on your forearm. But I normally I have it with me. It's annoying I don't actually, but and it's quite a handy little thing that you can just have in your handbag. So
Mm.
whereas with the gel, often you've got to wait for it to like dry, and women are often waddling around with their trousers rolled up, sort of waiting for it to dry. The spray literally dries in less than a minute and it
Oh,
doesn't leave any sticky residue.
yeah.
And if it's in your handbag and you forget to do it before, obviously because it's on your arm, you can put it on anywhere, and
Mm.
that's quite a nice one.
That's really interesting. Yeah, I didn't know any of those, so I'm getting educated myself on these things. And I suppose just another question about the transdermal patches. I suppose once you have it on, it lasts for a certain number of months, and you can't really change the dosage, whereas you can with the pumps and the spray.
Yeah, it's not months. You sort of every so many days, and like say and then if you need progesterone, you'll be taking that patch sort of the last part of your of the month. But but yeah, so that's the only problem with that you can't change. You
Mm.
know, they come in like 25, 50, 75, 100, whereas Some women, they find they have certain times of the month that they need a little bit more than others. So that's where the spray and the gel can be a little bit more flexible.
Mm, mm, okay, great. And would these be provided by the GP, or where would you get these kind of resources?
So GP, yeah, you can go private, particularly if you're thinking that you need testosterone. The problem is that when you have your bloods, if you get offered bloods, one, you need to be having them at a certain time of the month, otherwise, the other problem with perimenopause is our hormones are fluctuating so much
Mm,
that often they're
mm,
inaccurate. So women are being told that they're not perimenopausal when actually they are. The easiest time really is when a woman is in postmenopause because hormones are level and steady. And the other problem is they say that you're within range, but range is huge and you can still be right at the bottom. And actually, they'll just say, well, no, because you're within range, particularly testosterone. There is other private companies. There's one actually that I've now started using, and I have been really impressed because they keep their prices down. They're called BioID. I've actually got some here. This is their testosterone.
oh,
Um, but and they actually do your bloods and they do it bespoke to your bloods, which is what I like. So I got told that my testosterone was in range on the NHS as well as my vitamins B12 and magnesium. And actually they were low. And BioID have put me on all of them. So estrogen, progesterone, testosterone, vitamin B12, which is methylated, and magnesium. And I've been on them about a month and I'm actually, yeah, really impressed. So
what
yeah,
have you noticed different, Michelle?
my energy and
Ah,
my sleep,
and sleep.
definitely.
Yeah.
Even though I'd had a hysterectomy for endometriosis, which is a whole different story, I did manage to get progesterone with my NHS HRT, but it still wasn't, I still felt like I needed a higher dose, which they don't like to do.
Hmm.
So this is, yeah, all bespoke. And like I say, they keep their prices down, which is good. And they even send a phlebotomist to your home or work, which I was quite
Oh.
impressed with. Um, and when I mentioned about my veins being, I wasn't going to do this like a promotion, it sounds like, but my veins are really small. So they sent one that was a pediatric specialist so that they're used to small veins. So I was like, wow. Um, and what I was also pleased with, because when I obviously said what I was doing and things, they've actually given me a discount code as well. So just Michelle 40, Michelle 40, you can get your consultation for £15. If you go ahead, you'll get that off your bloods anyway. And then a further £50 off your hormones if you go ahead with it. So that I've just been impressed with the company, really. They just seem to be really they like the fact that they want to keep their prices down to try and make it as affordable
Mm.
as
That's really,
possible.
really good to hear, isn't it? And what is interesting, you're now promoting them on a,
Yeah, I know.
on a podcast and advertisement, but in a very genuine, authentic,
Yeah,
your own personal experience, which is great, isn't it? That's really, really good.
definitely.
And people can
Those
then
that
go,
know me know that I wouldn't ever mention. I get sent because of my TikTok and thing. I get sent products quite often, but I don't promote them because I just don't. I haven't either aligned or something just or they just didn't work. So yeah, people that know me know that I don't.
and it's great, Michelle. I know you. I know you're an expert in your field, and you're incredibly successful in your teaching. And I also know you're very passionate about it. But I think you're also very honest and authentic. So you would not be saying this if you didn't find this particular you know product very, very effective. So thank you for being honest and sharing that. And again, it's going to direct so many people to so many women to actually feel better about themselves and like you say, that perimenopausal, it can start at any age, really, can't it? I mean, you can tell me more about that in a minute, but if you're nowadays, women are working and often in quite high level positions, and some actually have children as well. So they're trying to give out to their children. And some, it's called the sandwich generation, also maybe have elderly parents. They're still, so the responsibilities are there. So it's very easy. One of the symptoms, I think, is what you're pointing out. It's very easy just to feel exhausted all the time and thinking that's your lifestyle rather than hormonal. So, so can you tell us a little bit more about some of the symptoms that you would have? Because women might know them, but they also might not know them about how you know whether you're perimenopausal.
So, yeah, I mean, there's over 100 symptoms because we have estrogen receptors in virtually everything. It's important to be aware as well that it can exacerbate any current conditions. So often, things like fibromyalgia, one, it can exacerbate it. Two, I think women are sometimes misdiagnosed with that if a doctor thinks that they're too young or so there's a lot of things that women can either be misdiagnosed or equally exacerbated. Um, Obviously, so the common ones are periods changing. Now, this doesn't necessarily mean lighter or shorter. It can be heavier and more frequent. So, and it can sometimes be subtle that you finish a day earlier than you used to. So it can be really subtle. If you're not having periods because you're on the coil or anything like that, then obviously not all women get hot flushes, but it can be one of the early ones. Insomnia, often it's a 2, 3 a.m. insomnia that you wake up and that's it. You just can't get back to sleep. But it's important, I think, really to the ones that are less talked about. So for gum issues or burning tongue, burning mouth, tooth loss, anything to do with or change in taste buds, um, difficulty swallowing can be one, or even a change to your voice. These are all obviously all these symptoms. I always say get checked to rule out because they've all got other causes as well that could cause them. So always please do get these checked out. Um, Plantar fasciitis can be one because with collagen declining, changing the soft tissue, it can change your feet, or declining estrogen can cause inflammation. So a lot of women I've come across get painful feet. Um,
Sorry, is that what fasciitis?
plantar,
Fasciitis?
sorry, yeah, plantar fasciitis, also known as policeman's heel.
Oh, okay.
Yeah, so painful heel or under the foot,
Okay, thank you.
frozen shoulder. Even things like carpal tunnel can be caused because um, you can have fluid retention, which can then put pressure on the median nerve, which can cause carpal tunnel. Um, so sometimes it is a condition, but it's not always what's caused it is sometimes what you've got to be looking into. In general, electric shocks or tingling of your hands and feet. Itchy ear is one that is made my TikTok go viral because it affects the mucous membrane in the ear. But so yeah, itchy ear can be one. What are some of the fun ones that, well, not fun ones, but
More unusual ones.
what unusual ones? Yeah, there's just I'd say dry, gritty eyes. Even tinnitus can be
Mm,
caused again because of changes in the ear.
mm,
Then we've got obviously got the psychological ones, anxiety, low mood, being overly emotional, um, really bad anxiety attacks. I mean, I went from being a really confident woman
mm,
to, I mean, I talk about it in my book, literally having an anxiety attack over whether I was getting the wrong cereal. And I
mm,
had to literally leave. That was the pinnacle moment, actually, when I went, this is not stress. And when I was sat in the car, literally my heart pounding through my throat, or it felt like it, tears down my, and I was like, there's something wrong with me. I've got to find out what's wrong. This is not stress. And then that was when I started researching and found the word perimenopause. And often that's the worst bit is the not knowing,
mm,
because when I found it, that was like a weight off my shoulders. Oh my God, it's a thing. I'm not going to die. It's
mm,
natural.
mm,
It's not dementia,
mm.
because that was my biggest fear, because my granddad having Alzheimer's and my nan having vascular dementia, I was like, oh God. Um, So yeah, it was that was the most relief was just finding out. Um, and as I say, then finding that anti-inflammatory diets can help, and then the weights, because I was doing all the wrong things, because actually um, certain exercise can actually make symptoms worse, which is why when I train the GPs, telling women go exercise is not helpful
Mm.
because actually by gunning it in the gym, I was raising my cortisol, which your body will prioritize your cortisol over your sex hormones, which is why everything was going Pete-tong. And as soon as I started reducing the inflammation, that was when the weight started falling off. My hair stopped falling out, my skin cleared up, the anxiety calmed down. It didn't help completely, but it did help bring down. I haven't had anxiety attacks now for a good couple of years now. So the one thing, something else that's unusual that I've found many women go, yes, travel anxiety, driving.
Really?
Out of
Oh,
nowhere, yeah, out of nowhere. I went
yeah.
from, I mean, I've always been a confident driver. I passed my test, and within a week, I was driving from Norfolk to Liverpool, motorway driving. It's never fazed me. I've always been good at parallel parking, hill starts, everything. And all of a sudden, I was reverse parking on a hill, and my legs went completely. And managed to get the car in. Again, I think I write about this in the book, but I just completely freaked out. And that's the one thing I've not been able to get over is hill starts. I'm all right if there's nothing behind me, but I've just got this paranoia now of rolling back into the car behind. It's never happened. I've always had good clutch control. But yeah, it's the one thing even now, if I'm having what I call I don't have bad days now, but if I have a day that I can just feel I'm a little bit anxious, I will avoid routes.
Mm. That's amazing, isn't it? To actually think it can have such an effect on your life where you
And,
suddenly get that travel anxiety,
and it's not even sometimes
incredible.
driving. I had one
Yeah.
lady that said to me she couldn't admit to her daughter why she wouldn't go and visit her in London anymore and always got her daughter to come to Norfolk. And it's because she's now got a anxiety over getting on trains.
Mm, mm.
So it could be different things, flying or trains or public transport or just anxiety in general going out. So it's
Yeah. I've got so many questions for you, but I just want to ask one about the anti-inflammatory. Now, I know your book is all about that. What was the name of your book? Just to remind the
you.
listeners.
It's called You, Me, Conquering Perimenopause and Menopause.
Okay, right, lovely. So people can buy that from Amazon?
Yeah, it's on Amazon.
Okay, great. So just give, I think, because it sounds a lot. But anything, when you say anti-inflammatory, what do you mean exactly? What can you give any kind of quick guidelines as to what that people might not know what that
Yeah.
means?
So it's basically these diets. So in the book, I go through various intermittent fasting because that can have an anti-inflammatory response on the body, and particularly the different types because there's certain women shouldn't do certain fasting over. Basically, women shouldn't really fast more than sort of any more than 16 hours at a time, particularly the week before their period. Um, so I go through the different types. Keto, so carbs, sugar can cause inflammation, um, and Mediterranean diet because I flick between the two because you shouldn't, any diet, even if it's good for you, if you're on it prolonged, the body almost just kind of gets used
Yeah.
to it. So you want to be flicking between, and keto is not really a lifelong one. So I like to sort of flick between the two. So Mediterranean is much easier to sort of stick to as a lifestyle more than anything. And it's just basically fresh ingredients because our processed foods will have sort of raise our inflammation. Equally, by losing weight, adipose fat itself has sort of like can raise inflammation as well. So as estrogen is declining, which again helps control our inflammation, if that's declining and we're putting on weight and we're eating processed foods and not sort of exercising, then it can all sort of have a bit of a knock-on effect. Particularly women that are more predisposed to insulin resistance because of menopause, because estrogen plays a part in glucose production. So it's again going for that 15-minute walk after you eat can help reduce your sh blood sugars. So that can be a way of managing as well. So there's lots of different
Mm.
bits and bobs really.
And actually, what you said is absolutely brilliant. And again, I would endorse all those diets. You know, you just mentioned ketone and Mediterranean because they are so. I mean, I follow those anyway, so I would totally agree with what you're saying, Michelle. But it's also, you know, when you're exhausted all the time, you just don't know why. Like you say, is it what is it? Is it physiology? Is it psychological? What's wrong with me as well? And that's something we can all do, isn't it? Is just kind of look at our diets and really think about what we're eating. And that's just a lovely summary. Just sort of try to eat more fresh food because that's also good for your brain and your mental health as well. It's good for your brain and your body. And loads of sort of information is coming out now about, again, mental well-being. If you get your physical health well-being and get that in order, might be just enough to help with your mental well-being. So yeah, really good points there, Michelle.
100%. And these are things I actually, so my workshops are actually quite interactive. I don't sort of try and do death by PowerPoint. So we do
Go
go
ahead.
into an example where I can get just by a thought, your saliva changing in your mouth. Where and it's quite interesting that, oh, and this is why it's so important to do de-stress techniques or calming. And like you say, especially if you're bookended with having teenagers and elderly parents, just to take that time. So, and this is where it's also relevant for men. So, de-stress techniques that literally take less than a minute, less than a minute. So, if you've got an awkward client or stressful teenagers, because let's face it, girls are going through the same, it's puberty in reverse for perimenopause. So often women are going through similar hormonal as their teenagers. So the poor men are in the middle as well, going, oh my God. Um, and so just by teaching even your teenagers these stress
Oh yeah.
techniques can help the whole dynamics of work, home, everything. So, and it's important to be aware that the common age for relationship breakups actually is 45 to 55 in women, which I don't think is a
Mm.
coincidence.
That's really good, isn't it? And I think you're also come with another point that I'm quite strong about is communication, isn't it? So if women become more aware of their cycles and what is there affecting them, and so even if a teenager girl understands more about her body and her moods and everything like that, and her mum understands that as well, or whatever caregiver there is for that teenager, oh look, this is why I'm, completely erratic today, and oh that's okay, that's fine, we need to accept that, and that's okay, and maybe not kind of, you know be punitive, be much more understanding and communicative over the sort of women's cycles and hormones. So yeah, very very
Yeah,
good point.
I don't know why it's not taught in schools. I've managed to train staff at a couple of schools, but I don't know why menopause isn't trained to during their PSE lessons or whatever they call them these days, because the boys need to be aware of what's going on with their mothers, with
Yeah.
their family members, and equally so they've got an understanding of when they're older,
Mm,
even if they're gay or whatever, whether
mm.
it's friends,
Yeah,
colleagues,
yeah.
so because I've trained at two prisons as well for staff. So I was last week I was at Belmarsh
Okay.
and who have asked me to come back because they only opened it up to the women this time, and they realised that from the feedback that Brixton Prison did have their male staff in there, the whole dynamics of them understanding their female co-workers and also their partners as well. So I will be going back to do, and also that they realised that I did need a lot longer for my full workshop. So I'll be back at Belmarsh, but yeah, because I do want to get into female prisons as well to be able to help both um, staff understand the female prisoners, but also the female prisoners understand themselves. So that's
Yeah,
one of my
it's
missions.
such a good point, isn't it, really? And the empowerment that can give the person again, isn't it, to actually say, okay, right, I'm not depressed, I'm not going mad, I'm not, narky or snappy, all those type of thing. If I get these not too there's a lot you can do naturally, can't you, which actually doesn't cost a lot of money, like a little bit more exercise, getting your diet right as well, maybe going getting more checkouts in your GP. Because another thing, just wanted to move on to really, Michelle, is the mental health symptoms are often masked. We said it earlier, to actually be, oh, this woman's got anxiety, depression, and actually they don't do the tests to see whether it's sort of perimenopause. Um, and then again they're on the medication sometimes, and the medication doesn't make any difference, and they're still depressed. Any kind of, I mean, any thoughts on what would you say to a woman who has started to have low mood? What should they do?
Well, it's obviously, first of all, just looking at her lifestyle, what's going on. I- Is it genuine clinical depression, or is it because I don't want us to go the opposite where we
Hmm.
dismiss certain conditions and assume that it's perimenopause or menopause, whereas before we dismiss it that it definitely wasn't. So I don't like the idea of flipping the coin
Mm.
on the other side. So always sort of looking at what's going on. Equally, there may be women where they've got a history, excuse me, where they might have had some trauma in the past, or they might have had depression in the past, but they've managed to manage it at the moment, whether that's kind of blocking it out or whether that's they've actually had it treated. And then it all of a sudden comes full pelt again. This is where hormones can actually bring things back to the forefront. So it's being aware that's where antidepressants do have their place alongside other treatments like HRT or diet and lifestyle. If there is an element there that there is from their past. So it's again, it's very, very complex. But if there's absolutely no history and it's out of the blue, nothing's happened, and you're just really feeling depressed, the chances are, and having a look at other symptoms. So I'd always advise sort of journaling, um, particularly if you go into your GP, because if you did what I did, which was go piecemeal of, oh, this month it's spots, last month it was hair loss, or you try and journal everything so that you can go in with one saying, look, these are my, and go in with literature as well on perimenopause in case they think you're too young. Because you touched on earlier that yes, it can happen at any age. Um, it's more common than we think for it to start mid to late 30s. I was 32 when my symptoms started, but and again, it's very extreme, but the youngest recorded was actually 11. So where
Wow.
she had about 5, 6 months of periods and then stopped. And she was actually in a documentary when I was trying to Google sort of the youngest, because I knew there was one in India who was 11. I was trying to sort of find out the youngest in this country. And she has actually done a documentary where she has had successful IVF.
Oh, how lovely.
Yeah. So, but obviously that's very extreme. And the younger you get, the rarer it gets. But it literally can be, or there's many reasons, but autoimmune women are more likely to have sort of earlier menopause. Obviously, you've got surgical, so there's lots of different reasons. Also, chemotherapy and radiotherapy. Many women actually aren't warned that they may get menopause symptoms when they, and that was one of my podcast episodes where she actually where her bone started to hurt. She was worried it progressed to bone cancer, and there was no advice that actually she was going through. menopause.
Mm.
So having that knowledge again can just be reassuring.
Mm. Absolutely brilliant, and I think that you made several really really good points there. But I think that what I picked up is not just, I think it's about making sure that the GP doesn't assume you have depression. You know that it could be this or it could be that. So it's about getting some kind of understanding or some tests, isn't it? Rather than jumping to the conclusion, it could be. You don't want to, like you say, it's about asking those questions. And I really like the idea of journaling your symptoms as well, and taking a leaflet if you're younger that it could be perimenopause, but actually just that's very useful, isn't it? Just noticing your symptoms and whether there is a cycle of symptoms as well, and what that is about as well. Like you say, is it around stress, any particular instance around stress, or if it's more like a cyclical thing that says it could be perimenopausal,
Mm.
if I've answered that correctly. So yeah, so that's a really good point, and that's probably the first person to go to is to go to the GP. But obviously, you know, just getting a book like yourself that could really help you. There's a lot of self-help material out there, and because your book is thoroughly, you know, scientific based and well researched, isn't it? That you know to trust that information, and that could be very useful just to sort of see whether you are and what you can do about it.
Yeah, or equally finding a menopause coach because yes, I do one-to-ones as well, but there's lots of other menopause coaches out there that can give you this advice and steps because as I say, journaling's one, but there's lots of other things you can do to sort of get GPs to listen or lots of it's as I say, sort of putting all these bits out there, but it's working out a plan for each individual.
Yeah.
So if you're if you're feeling like perhaps you're just not quite getting there with NHS style, then look out there because there's plenty of menopause. I don't sort of call myself a coach as such. I do one-to-ones, but I'm more of an educator, I suppose, where I give them the tools and the strategies to be able to, and even with these workshops, they've got tools and strategies from day one
Mm,
that they can use. So it's not something that you have to wait
mm,
for, and then we work through and then continue with everything else because um, I work with transgender as well,
mhm.
or different cultures that we
Good.
often forget because different, especially different cultures, they their views on menopause can be vastly different. Some cultures, it's considered something that's brilliant, and in other cultures, it's really bad, and you don't talk about it, and so they might not be getting help anywhere. So, which is another reason why, if they're getting training at work,
Mm.
then they can learn about, yes, that's what I'm going through, and um, that's how I can help myself. So sometimes, particularly if they are in an environment where they're not necessarily able to go for help, they might not feel confident in talking to their doctor. So knowing all the different options can really help as well.
And I think, you know, a really good thing is it is again talking about it and communicating about it because a woman perhaps a bit isolated, either on her own or perhaps in a family that don't speak about these things because they're women's problems and they're embarrassing and shameful. You know, if you've got that kind of belief around you, then you're less likely to be open up and seek help, and then you're suffering in silence, aren't you? So, whatever culture you come from, you know, it's really important, isn't it, to start to ask those questions or have those conversations to really find out and understand much more about, you know, what are your symptoms about and what they could mean, and just trying to take away the stigma around menopause, isn't it? That's, I think, part of what you're doing.
Yeah, there's a lady she's on TikTok. She's another sort of menopause coach, and we had a meeting last week, and she's based in Lagos in Nigeria, and it was interesting. Even out there, perimenopause can actually be considered that you've been cursed.
Wow.
Yeah, so
Yeah.
this is what I was, and there's so many different cultures where, I mean, even in the UK, we were put in asylums if So when I get asked why are women only talking about it now? Surely, well, actually, the ones that did suffer were the ones that got put away. So, and we're living longer, and women didn't work, or they definitely didn't work this late in life. And because we were dying younger, often menopause didn't really start until our 50s, 60s, and that's when we were passing away anyway.
Mm,
Plus, our diet and lifestyle is significantly different now. So, and we've got lots of chemicals. That's something else I touch on is or endocrine disrupting chemicals that can affect our hormones that are found in virtually everything. But there are ways to sort of, again, I teach sort of how to reduce your exposure to them.
mm,
But because they can have quite a considerable impact on making us sort of estrogen dominant, even if our estrogen's at the right level. So it's
mm,
there's lots that I sort of go into
mm.
on.
Yeah. I think one thing I encourage people I support to consider, again, I like the idea of logging it and keeping a diary, making notes about those things, but also changing one thing at a time. Because I think what can happen is even if you're trying to get your HRT correct, there's so many variables there, and then that can affect your mood. Like, and you mentioned testosterone, which again is sort of not talked about very much. So that's a really good point. But if you're also trying to work out, say you've been given depression medication or anxiety medication, there's so many things going on, and then that can get quite confusing. And you can have side effects, can't you, as well? So is it a symptom or is it a side effect? And then that can become very overwhelming, confusing for a
Yeah.
woman, isn't
And I
it?
think one thing that is, I think, really important to be aware when I talk about conditions that can be exacerbated is neurodiverse as well. Women with ADHD, which is me,
Mhm.
um, and like you said, when it came to the HRT, I've always known that I was ADHD, always known. I mean, my mum got a job in a nursery, not because she was qualified, but because they said if you can control Michelle, you can control any child. Because I just used to run around like a Looney Tune, and lucky if I completed one project, that you had on the table. But after, particularly when perimenopause started, but definitely after my hysterectomy, um, I was very conscious that my coping strategies weren't working at all, and I was getting a lot of burnout, a lot more. I was just struggling in general, and I'd been thinking about trying bio ID hormones because I was very aware that even though, as I said, I'm struggling because of my diet and lifestyle, and NHS HRT was okay, but I just felt I wasn't at my optimal. But I bit the bullet and got myself diagnosed with ADHD so that I could see if medications helped, which they have done massively. But again, it was the same time with the HRT that was so in the end I had to say, right, I'm gonna do the HRT first, and not HRT, do the ADHD medication first, get myself level on that, and then I know how the
Mm,
HRT has helped. So definitely I always advise don't
mm,
try and do everything at once because even it's not just what helps, but also if you suddenly start feeling worse,
mm.
which one is it?
Yes.
So definitely, if you are someone that's going to start some medication for something else, make sure you do one thing, get
Mm,
that settled,
mm.
and then try the next thing, definitely.
Well, I think we're celebrating, individuality of women and all these kind of things that come in, and also it can be men as well, is this kind of thing. And I just want to absolutely about the neurodiversity. It's a really good example, just said Michelle, but I'd also add trauma to that. So sometimes if people have trauma and they've got trauma in their body as well, that can lead to all kinds of anxiety and everything like that. And also can lead to inflammatory body problems as well. I've worked with a number of women who, once they got their trauma sorted, they actually became much healthier as well. And some of the inflammatory diseases that they had went, and they just don't have them anymore. Pain and all those kinds of things as well. So So it is. I suppose I think what we're both saying, the message is, you know, is seek help, get help, and find out, what you can do. Definitely include the menopausal symptoms as well, and understand yourself better. And you can actually have a really great life, can't you? You can just because you're might be assumed slightly older, you can still have amazing health, energy, positivity, and live the life that you want. And that's what we're sort of talking about, isn't it?
Definitely, and I think it's good to end on a high because everyone always thinks that menopause is all doom and gloom, and this is why I do end my workshops on a high as well because actually menopause can be a really positive thing
Yeah.
because it once hormones have sort of leveled out and we've managed to sort of find our way where we are, our brains actually like recalibrate. And that's why you often find older women are stronger and more confident minded. But also because we're now thinking about our health, we end up healthier.
Mm.
And we're looking for new because we're looking for new hobbies. We meet new people and we meet new friends and or new things that we enjoy. And it can actually be a positive time. And I know there's probably women listening who are maybe struggling at the moment thinking this is not positive. Well, this is why it's never too late to find things that will help you. You don't need to be suffering. It's it's something where we can find ourselves again. And I definitely now feel back to being a very strong woman again. I have started doing things that I love again, like my cooking again, and things that I'd in the past just gone a bit, can't be bothered.
Yeah.
Um, but yeah, and yeah, I feel like I've now found me again.
Mm. Oh, and that I found me again. What a lovely quote to finish on. I found me again.
The
And
new
that
me.
idea of feeling loss or not important or just tired all the time or what on earth is wrong with me? I've been to the GP and I'm just give me a pill. Um, don't get me wrong, there's fantastic GPs out there, isn't it? But I suppose it's about us empowering ourselves to ask the questions and to get the assessment right so that we do get the proper treatment because I
And
know
so you can get
these
the
are very,
most out of the because it's not the GP's fault
no,
necessarily because they don't want 10-minute appointments any more than we do.
no.
So it is, I mean, when I was a first contact practitioner, which is virtually like a GP in GP surgeries, um, we got 20 minutes because
Mm,
we're assessed, and I didn't feel that was long enough.
mm,
So, 10 minutes is not. So if you're making sure you've got everything ready
mm,
and you can get the most out of
mm,
and ask your surgery, do
mm.
they have a women's health trained?
Yeah, yeah.
Because
Good
some of
point.
them do.
Yeah, very, very good point. Yeah, ask the questions. Yeah, be empowered and ask the questions. Very good, very good. So, Michelle, I just want to just mention to listeners that all your details will be in the show notes, but can you just sort of repeat the name of your book and some ways of people contacting you because they might want to book a training course, they might want to get your book. There's all kinds of, might want to have a one-to-one with you, all those kind of things. So are you okay just to sort of give the listeners your details and we'll put
Yeah,
them in the show notes?
definitely. Yeah. So the book is, in fact, it's here, so you know what it looks like.
Good.
So it's You Me Conquering Perimenopause and Menopause, which is on Amazon. Um, you can either get my website is www.panaceapause.co.uk. So panacea as in the goddess of healing, and then pause. Um, or info@panaceapause.co.uk. I'm on pretty much if you Google my name, I come up somewhere. So I'm on TikTok, you name it, I'm on it. So,
Plenty of
but
ways
yeah,
to
I
keep.
do travel, but the workshops or the one-to-ones can be online as
Yeah.
well.
Oh, well, brilliant. Brilliant. Okay. So, Michelle, thank you so much for your amazing knowledge on this subject and your positive message as well. And thank you for sharing bits of your story because I think it's really interesting how you kind of you know what it feels like, don't you? You've been there and you so have I as well, of course. But you know what it feels like and that's a great message to women and also people who support women. So thank you so much, Michelle, and lovely to have you on the podcast. Thank you. And thank you everyone for listening.